Top 10 Skin Disorders of Human Body. 1. Skin tags. Skin tags are small, fleshy, vascular, pedunculated, on a stalk, growths that often are found on the neck and armpits. They are generally asymptomatic, unless they become irritated by frictional forces, or their blood supply becomes compromised. They are very common, and need not be removed or destroyed, unless they become irritated. 2. Acne. Acne vulgaris is a non-infectious eruption of papules and pustules on the face and occasionally on the chest and back. It occurs in all teenagers as they progress through puberty. Comedones, blackheads, and inflammatory papules and pustules are all present simultaneously. This is not a condition of dirty skin, but is mediated by hormones that begin to circulate during puberty. The condition generally resolves around the age of 20 to 30, but may produce scarring if severe and left untreated. 3. Athlete's foot. One of the most common causes of athlete's foot is an infection of the dead superficial layer of the skin, called the stratum corneum by a fungal mold, Pityriasis, called a dermatophyte. If inflammatory, it may produce a blistering eruption which is quite itchy. Non-inflammatory Pityriasis produces a dry scaling appearance, and is frequently not very irritating. Pityriasis is probably frequently contracted by walking barefoot in locker rooms. Topical antifungal creams are available over the counter and can be helpful in treating the infection. 4. Moles. Although the term mole may cover a variety of different sorts of skin growths, most often it refers to a localized accumulation of pigment-producing cells called melanocytes. These are generally uniform in color and round in shape. Melanocytic nevi, moles, range in color from beige to black. They're 1/2 inch in diameter and are often located on sun-exposed skin. Poorly pigmented individuals may have an average of 35 of these growths by the time they are 35 years old. These are benign lesions, but can be confused with various pigmented skin cancers. Pigmented lesions that itch, bleed, or grow could be cause for concern. 5. Age or liver spots. These flat brown spots typically appear on the face and forearms of older individuals. Although they cause no symptoms, patients detest them because of their unsightly appearance. They can be treated in a variety of ways, but treatment is not medically necessary. 6. Pityriasis Rosea. This rash usually begins in a young adult as a single scaling bump or patch, and then extends to cover much of the torso with many scaling spots that are elliptical in shape. They are associated with modest itching which only occasionally requires treatment. The condition usually lasts about 6 to 8 weeks in total. 7. Melasma. This condition occurs most commonly in women of childbearing age, and is often associated with pregnancy, or the ingestion of oral contraceptive medication. This flat brownish pigmentation occurs on the forehead, cheeks, and in the mustache area of the upper lip. It often persists after pregnancy, or after birth control has ceased. Sunlight will make it darker. Successful treatment is not easy, and strict sun protection is a necessity. 8. Warts. The development of small keratotic tumors of the skin is caused by one of about 200 members of the human papillomavirus group. They often spontaneously go away, but particularly stubborn warts may require medical intervention. The proliferation of various treatments reflects the fact that successful resolution mostly depends upon the patient's immune response. There are a variety of treatments available without a prescription that ought to be tried prior to seeing a physician. 9. Seborrheic keratoses. This is the single most common benign bump present on people as they age. Lesions may be present anywhere on the body, and generally do not produce symptoms. They appear as black, brown, or yellow bumpy lesions which give the appearance of having been glued onto the skin. They are of no medical significance aside from the fact that they are occasionally confused with pigmented skin cancers. 10. Seborrheic dermatitis. Seborrheic dermatitis is the single most common rash of adults. When it occurs in infancy, it is commonly called cradle cap. The adult disease tends to favor the scalp, skin behind the ears, forehead, brows, nasolabial folds of the face, mid-chest area, and the mid-back, producing an itchy, red scaling dermatitis. The scaling in the scalp can be conspicuous, producing impressive dandruff. The cause of this condition is unclear, but it responds well to topical steroids and to topical antifungal creams. Medicated shampoos containing tar, selenium sulfide, and zinc pyridine are often effective. This condition commonly improves spontaneously, but will ultimately recur. There is no cure, so treatment must continue indefinitely.